All right, for those affected with cancer, the fight, doesn't end once someone has survived the cancer. And for some, neither does the pain, but there are always ways to ease that pain. I think this is an interesting topic because a lot of times we discuss people fighting cancer, dealing with cancer, but there is very much a story on how to treat them once they have survived. And here with us this morning, we have Esme Finlay, Dr. Esme Finlay from the University of New Mexico Cancer Center to talk about this. Good morning, doctor. Thanks for dropping in.
Hi, thanks very much.
This is very interesting. You actually had a review paper that was recently published in the Journal of Clinical Oncology. Can you tell us a little bit about that?
Sure. I'm a medical oncologist, which is a chemotherapy doctor at the University of New Mexico, and I'm a pain specialist.
Okay.
And the paper was a collaboration with other experts around the country on how to help people with pain after their cancer has been treated and cured.
Okay, and that's interesting to know because, as I mentioned, a lot of times we don't discuss what happens afterward, but there is some pain associated with someone who has survived, or we call a cancer survivor, right?
Yeah, maybe 5 to 10% of people after cancer have persistent pain.
Okay, so what's the deal? How do you help someone in, I guess, what do you call it, post-pain?
Yeah, chronic pain after cancer treatment. There are many things we can do, but the most important thing is that a patient tell their doctor they're experiencing pain, so that we can do a comprehensive assessment and make patient-specific referrals to experts like pain specialists, physical therapists, exercise therapy, those kinds of interventions.
Well, and you folks at UNM are certainly doing so much. We're always hearing new ways on new things that are happening with the center itself and new ways to treat patients. For those that experience chronic pain, aside from contacting a physician, is there something that you can give them? Is it more medication, or are there certain therapies?
Yeah, I think we do use many kinds of medications depending on a patient's symptoms. We also can refer to the Chronic Pain Center at UNM or the Center for Life for more holistic things like acupuncture or massage. So there are many things we can do. We work with a great physical therapist to help people get functional again and be engaged in activities in their life.
You know, doctor, I found what was interesting, we were talking during the commercial break, was that you're seeing more and more of this. And that is, in some respects, a good thing because more people are surviving cancer. Is that right? Can you talk a little bit about that?
Yeah. It's wonderful. We're doing a much better job getting people through their cancers and getting people into that survivorship phase after they've finished treatment. And now when we look at the people who've survived cancer, more than 40% of those people are out more than 10 years. So we're doing a good job, but a small portion of those people have symptoms that go with them. And that's really about what this article is about, is helping people with quality of life after treatment.
Sure. And I'm sure it's on a case-by-case basis, but about how long, on average, does a cancer survivor experience pain after?
Many people, their pain will go away within weeks or months from treatment.
Really?
Often within the first 2 years. It's just a small portion, maybe 5 to 10%, who might have persistent or chronic pain.
Very interesting. Thank you so much, doctor, for dropping by, shedding some light on this. By the way, for more information on Dr. Finlay and the UNM Cancer Center, please go to our website. We have a link for you there. It is casa.com. Click on the CASA blog. Good to see you. Thank you.